Abuse and neglect are easier to detect when more eyes are on vulnerable populations, such as the developmentally disabled and those with serious mental illness. Keeping agencies accountable to those they serve is easier said than done. But dedicated citizens like Holly Giesel and the many other volunteers who serve on Arizona's independent oversight committees are helping. They not only serve as the legislature's eyes and ears for some of the most vulnerable individuals in our state, but they helped pass important legislation, strengthening the functionality and independence of the committees themselves this year.
The members of these committees, and I'm one of those members, dedicate our time after work on Saturdays or over the weekends to go out and actually do site visits unannounced at facilities that are providing publicly funded, state paid for, in other words, behavioral health services for the seriously mentally ill. Arizona spends over $2 billion a year, $2 billion a year on services for individuals living with serious mental illness. The purpose of the IOCs is to have unpaid, absolutely volunteer public citizens out in the community providing independent oversight into the cost, the quality of these services for our citizens who are living with serious mental illness. We discovered fundamental flaws in the information system that generated addresses for access enrollees receiving behavioral health services. 1/3 of those addresses were wrong. That meant the state's paying for somebody, and the address they have on record for 6 months is incorrect. The independent oversight committees faced new pushback when the behavioral health services for the seriously mentally ill were rolled into Access. Access's efforts served to limit the independence and limit the oversight of the committees.
Over the past year, the relationship between the Oversight Committee and the state has soured. That's according to members like Gilcoat, as well as documents reviewed by KJZZ. Much of the dispute centers on what information the committee gets from the hospital. Information like the stabbing of Aaron Wallace.
I didn't see it. Then the next month came and I didn't see it again. We wondered what was going on.
Since late last year, Gilcoat says the committee has not been getting reports about other incidents, things like deaths and serious assaults.
If we're not hearing about this, what else are we not hearing about?
Gilcoat isn't alone.
There were several deaths. There were some very troubling issues that had arisen, and the hospital refused to give the Independent Oversight Committee records.
But when we see something or hear something and ask for more details, when roadblocks are thrown in our face or we're told, no, we can't get that, or obstacles, that just makes me want to fight harder.
When the committees faced this new pushback from Access, Senator Barto assures that there will continue to be independent oversight of the services paid for by the government and delivered through government contractors, and that oversight will be provided by volunteer citizens, not by hired consultants, not by bureaucrats, not by regulators, but by volunteer citizens. I can't think of any single way that we can better assure a healthy future for individuals living with SMI in our state than with this legislation, which Senator Barto and the governor made possible.
There is more work to be done to make Arizona's independent oversight committees as independent as they need to be, but it's work worth doing on behalf of the vulnerable individuals Arizona serves. Learn more at nancybarto.com, and thank you for your support.